There's always this idea that doctors should be somehow cold or should be able to detach from their feelings, from their patients, in order to give good attention. He was a baby that was born in some other hospital. He had seizures and other signs that made us think he had meningitis. The treatment for neonatal meningitis is at least 28 days. That is the minimum of treatment that you can offer. On day 11 of treatment, so we were not even in the half of the treatment, the mother started having some respiratory distress, fever, and cough. It was a big risk that she could indeed have COVID-19. As we were not a COVID-19 center, we did not have the full PPE for treating patients with COVID-19. The COVID center would probably not be able to take care of the baby. And in a not COVID center, they would not allow the baby in because the mother had COVID. So that's why we discussed with the mother and we said the best option that we can come with is that you bring another caretaker. Your sister, your mother-in-law, your mother, whoever, we just need another caretaker to stay with your baby for a few days until he completes the treatment. The mother and the father told us, we have absolutely no one, but please let us stay in the hospital because we understand how important this is for the survival of our baby. We were not able to keep a baby alone with no caretaker. That's just, you cannot do that. Mothers and babies should not be separated. Especially newborns. They should stay with their mothers. This mother was breastfeeding, so this is definitely not an ideal choice for any patient, any sick patient. So with no other choices, what we offered was, okay, bring the baby every 8 hours so we can give him the medication and we can check on him. The father came every 8 hours, so he came at 2 p.m., he came at 10 p.m., he received all the medication. The next day, he came again at 6 a.m., received the medication, went home, and around 10 a.m., we received a call from the emergency room saying that this baby that had been hospitalized with us arrived dead to the ER. The baby had seizures at home, probably went into apnea, which means he didn't breathe, he stopped breathing. And that's exactly when the baby died. By the time the parents arrived to the ER, there was nothing to be done. It was definitely a very difficult situation to deal with, especially knowing that this baby could have survived if he had stayed with us in the hospital and received the full treatment. It happens often in the humanitarian setting that you are confronted with the question, do I save one patient or do I save a bunch of patients? So when confronted with that question, it's always, okay, numbers. More patients, it's better to give good quality of care to more patients. So that's why the decision was, we cannot keep this mother and this baby because it represents a risk for the others. Although, of course, you understand the pros and cons of keeping this baby or discharging him, you cannot help but feel guilty about it and think, oh, I should have done more. We should have looked for another possibility, another plan. It is also important to allow yourself to feel the sadness of the loss of a patient, to feel the anger. I don't fully agree with this idea of you should be completely detached from your patients. You should not get emotionally involved. If you don't get emotionally involved, then you don't care enough. And if you don't care enough, then you're certainly not going to change things for the better.